Hello everyone. Today we are going to be discussing a particularly important topic that a lot of people are just not well informed enough about, and that is lung cancer. Today we are going to be talking about the causes, symptoms, what treatments there are available, and how you can prevent yourself and your loved ones from ever catching this terrible disease. Firstly, we are going to be talking about the causes, and as you may have already predicted, the main and the most common cause for lung cancer is smoking tobacco, particularly cigarettes. There are many chemicals in tobacco smoke, and some of these chemicals are carcinogenic, which means that they are able to cause and trigger the development of lung cancer. Here's a fact that some of you may not have known before. About 72% of Canada's lung cancer cases are actually due to smoking tobacco. Also, something that people often disregard is secondhand tobacco smoke, which is also a huge risk factor for lung cancer among non-smokers, yet a lot of people do not take it seriously. Yet another main cause for lung cancer is radon. Radon is a noble gas which is derived from the completely natural breakdown of uranium in soil and rocks, and it can seep into buildings through dirt floors or cracks in the foundation. Exposure to radon significantly increases the risk for lung cancer. Moving on to the last major cause of lung cancer, and that is asbestos. Asbestos is the name of a batch of minerals that are found naturally and can be separated into long, thin, and very fine fibers. And when someone breathes in these fibers, they can get trapped in the lungs, and then over many years, those fibers can cause enough genetic and cellular damage to make lung cells turn cancerous. The people who are going to have the highest risk of asbestos exposure include workers in asbestos mines, shipyard workers, automotive industry workers, including brake and clutch repair workers, cement plant and construction workers, plumbing and heating tradespeople, painters, carpenters, electricians, or just simply people who live or work in a building insulated with asbestos. Maybe the most famous instance of asbestos being used in a building is the World Trade Centers, the Twin Towers in New York City. And we all know about the very horrible attacks that were conducted on them. But actually, a few weeks preceding to the attack, a few floors had actually been closed off due to renovations because on those specific floors they were insulated with asbestos, and after awareness was raised for lung cancer due to asbestos, precautions were taken, and unfortunately the renovations were never completed. There are a few other minor and less common causes for lung cancer, such as in the workplace, a person can be exposed to carcinogen chemicals such as arsenic, beryllium, silica dust, cadmium, mustard gas, diesel engine exhaust, uranium, and plutonium. And there are many professions where people stand a greater risk of getting lung cancer. For example, people who work in rubber manufacturing, oil and steel founding, coke production, chimney sweeping, commercial painting, roofing, and road paving all stand a higher chance of getting lung cancer. There are also a few other miscellaneous causes for lung cancer, which include people who were exposed to ionizing radiation during atomic bomb explosions or nuclear accidents, which are obviously going to be much, much less common than any of the other causes mentioned above. People who have had lung cancer in the past, or simply someone who has a first degree relative, meaning parents, siblings, or kids who had lung cancer in the past. And now we are moving on to the symptoms of lung cancer. The vast majority of lung cancer cases do not cause symptoms until the disease has advanced quite a bit, mainly because the lungs have very few nerve endings. However, there are still some people who experience early lung cancer symptoms. They may include a new cough that is persistent or worsens, a cough that produces blood, pain in the shoulders, chest, or back that gets worse during coughing, deep breathing, or laughing, or a shortness of breath that comes on suddenly and happens during normal everyday activities. That is also in addition to unexpected weight loss, loss of appetite, lung infections such as bronchitis or pneumonia, feeling tired or weak, and hoarseness or wheezing. These symptoms that I have just mentioned are only the most common ones. There are also many less popular ones, such as swelling in the neck or face, difficulty swallowing, pain while swallowing, and changes in the appearance of fingers, named finger clubbing. And as the cancer progresses and gets more serious, the symptoms also get worse and worse. A few of the symptoms a patient might experience include bone pain, swelling of lymph nodes, such as those above the collarbone or those in the neck, nervous system changes such as dizziness, balance problems, numbness, or weakness of a leg or arm from cancer spread to the brain, and finally, yellowing of the eyes and skin from the cancer that has spread to the liver. Now you might be wondering, how can this deadly disease be treated? But don't worry, I will be telling you about the 5 main ways in which lung cancer can be treated and potentially cured. Firstly, we have chemotherapy. Chemotherapy is the most common and popular treatment for lung cancer. Chemo is a treatment that uses special medicines and pills to shrink or kill the cancer cells. Although effective, chemo also has some side effects, such as loss of appetite or weight changes, hair loss, mouth sores, diarrhea, nausea and vomiting, fatigue, and constipation. Chemo can also affect the blood-forming cells in the bone marrow, which can lead to an increased chance of infections because of low white blood cells. Another treatment method is radiation therapy. This therapy uses high energy rays to destroy the genetic material that controls how cancer cells grow and divide. Although this treatment is extremely effective, it does have multiple side effects such as difficulty swallowing and a dry mouth, gum and mouth sores, heartburn, fatigue, hair loss, shortness of breath, diarrhea, sexual dysfunction, and the skin on the chest and back may become red and dry, kind of like sunburn. The third kind of treatment is called targeted therapy. This therapy is mainly used as a treatment for patients who have a particular specific abnormality in their tumors that can be found through biomarker testing. Biomarker testing looks for any changes in the tumor's DNA, and these changes can be mutations, deletions, additions, or rearrangements in the DNA. As the name suggests, targeted therapy targets specific kinds of abnormalities in the tumor's DNA. This results in fewer side effects because the treatment focuses on targeting precisely what is wrong with the cancer cells instead of killing healthy normal cells along with it. However, as with any other treatment, there are some side effects to targeted therapy, such as diarrhea, skin problems, high blood pressure, gastrointestinal perforation, and liver issues such as hepatitis and elevated liver enzymes. As we get close to the bottom of the list, we reach immunotherapy. Immunotherapy uses targeted antibodies and cancer vaccines to enhance immune cells' cancer-fighting capabilities. This helps the immune system recognize, attack, and eliminate specific cancer cells. Immunotherapy can also be combined with various other treatments such as chemotherapy, radiation therapy, surgery, or targeted therapies to improve its effectiveness. Immunotherapy allows metastasized lung cancer patients to live longer than ever before. However, immunotherapy does also have its side effects that include fatigue, fever, diarrhea, nausea, shortness of breath, itching, weight loss, vomiting, and headaches. And now we reach the last main treatment option for lung cancer, and that is surgery. In lung cancer surgery, doctors perform an operation in which they will cut out the cancerous tissue, effectively reducing the size of the tumor. There are 2 main most commonly used approaches to removing parts of the lung. The first one is through a thoracotomy. In a thoracotomy, the doctors will create an incision on a patient's back and the side of the chest, which follows the ribs' curvature. It usually involves dividing some of the muscles on the chest wall and then gently separating 2 ribs to allow the surgeon access to the lung. The second method is called a thoracoscopy. This approach involves 1 to 4 small incisions being made to access the inside of the chest. The surgeon uses a minuscule camera to visualize the lung and special instruments to perform the surgery. This kind of surgery, which, believe it or not, can be conducted with the assistance of a surgical robot. We have finally reached the last category, and that is how to prevent and reduce the risk of getting lung cancer. Now, there are many ways that someone can try to avoid and prevent lung cancer. Probably the most obvious way is not to smoke, and if the person is currently smoking, to stop, and also to avoid any secondhand smoke a person may encounter at work or public. This is something that people neglect upon quite often. Secondhand smoke is extremely dangerous. It's as dangerous as actually smoking a cigarette in of itself. Secondly, a person can have radon levels in their house or workplace checked, especially if they live or work in an area where radon is a known problem. If the presence of radon is discovered, then it can be remedied to make the workplace or home safer. Lastly, they can take precautions to avoid being exposed to carcinogens in the workplace. Furthermore, to always follow their employer's precautions. For instance, if a person is given a face mask, they should always wear it at all times. There are many cancer-causing agents in the workplace, such as cadmium, chromium, or asbestos, just to name a few. And there are laws that can help protect a person from being exposed to them in the workplace. And there are also laws in place that prevent smoking in closely compacted public areas and workplace that can also help lower the risk of being exposed to secondhand smoke, which in turn will lower the risk of lung cancer. If you have made it this far, then congratulations, you now know more about lung cancer than the average person does. I sincerely hope that this podcast will help prevent you and your loved ones from ever catching this horrible disease that is lung cancer.